And welcome back, everyone. September is National Prostate Cancer Awareness Month. Unlike breast cancer, prostate cancer isn't something that's talked about often. Some are trying to change that, especially this month. Joining me this morning is Dr. Patrick Wirtz of the Urology Group, along with Marcus Brooks, a prostate cancer survivor. First of all, thank you very much for joining us.
You're welcome.
Marcus, I'm going to start with you. When were you diagnosed? What was your reaction? Because I look at you, you're a young guy. You're not really the face of prostate cancer. How were you diagnosed, and how do you feel afterwards?
I was diagnosed 4 years ago. My church, Word of Deliverance, had a family conference, had a van outside, and I said, let me go out there, and my PSAs were high.
Yeah.
And I did a biopsy, and after that, they found 4 small prostate cancer cells.
Okay.
So as of January 2015, I will be 5 years cancer-free.
So getting the word out is important to you?
It's very important.
Why is it so hard to get the word out, Doc?
Well, unlike women, men have a tough time talking about it.
We don't like to talk about it at all.
It's terrible.
We barely take ourselves to the hospital.
Right.
And so it's guys like Marcus that really get the word out and get you to get screened.
How scared were you when you were diagnosed with prostate cancer?
I was really scared.
Yeah.
But, you know, I've come to realize early detection saves lives.
Yeah.
And I was happy that since God saved my life, I said, let me empower other young men to get checked, because a lot of men don't want to talk about going to the doctor, getting checked and stuff like that.
And Dr. Wirtz, I mean, there are a lot of, especially new technology out there to battle prostate cancer, correct?
Absolutely.
What are some of those?
Well, there's, first you need to be diagnosed appropriately, staged, to make sure it's clinically localized.
Okay. And
then you have a choice of surgery, radiation, and sometimes the cancer is not even severe enough to warrant treatment, and we can watch it. And so you need to develop a very good relationship with your doctor.
Absolutely. And don't you think the more you talk about it, the more it stays in people's head in terms of make sure they get checked when they should get checked?
Absolutely. It's a discussion that you just have to have with your doctor.
Tell me about who needs to get checked when.
Well, that's actually a controversial area.
Okay.
There's different groups that suggest doing it this time and at this time, but...
What do you suggest?
I suggest starting at about age 50.
Okay.
And you should get screened with a digital rectal exam and a PSA at least once a year or maybe every other year, depending on risk factors.
That whole process scares a lot of guys, but I went through the process myself, and I got screened probably 2 years too late. It's a really easy process.
Right. Very easy.
Right? I mean, it's worth it because early detection is key.
Yes,
right, Marcus?
That's the key. Early detection. I stand on that. Early detection saves lives. And it's an easy process.
Yeah.
Very easy.
It starts with a blood test. My last question for you, doctor, is the color of prostate cancer, the ribbon is light blue. Most people don't know that. They know breast cancer is pink. How long do you think it's going to take to change that?
Well, you know, every year this gets more and more big.
Yeah, we're talking about it more.
We talk about it more, so I'm hopeful that it's not going to be a stigma to talk about prostate cancer.
I agree. We want to put some information up on your screen. If you're interested in getting involved, or if you have a prostate cancer survivor in your family, you might want to check this out. This Saturday, September 6th, is the Zero Prostate Cancer Race for 2014. It's at the Urology Group. That's off of the Norwood Lateral. You can see it, a beautiful building off of Norwood Lateral. And you can find out more at fox19.com. You can still register. You can also register on the day of the event. Dr. Wirtz, Marcus, thank you very much.
Thank you.
All the best for you guys. I'll see you on Saturday.